Hello, Dr. David McFadden from the Dental Implant Center in Dallas, Texas. Today's topic is the dental crown. Almost every adult in America has at least one dental crown. So we've all been through the procedure. All crowns are not created equally. Let me explain why. The American Dental Association specifies that our crowns in dentistry are acceptable when they fit to within 200 microns. Let's just suffice it to say that's a teeny tiny microscopic space. And that's the space that exists between the margin of the crown and the margin of the tooth. So how do we get great fitting crowns? First, you have to have a dentist who cares about getting great fitting crowns. Second, technically the dentist has to be able to do the work, meaning with our magnification loops, our lights, and our fine motor skills, we create a perfect preparation. That's the first part. The second part is we have to find a way to make a perfect impression of that perfect preparation. Two ways. We use the gooey material that everybody's had in their mouth at varying times. Everybody who's had a crown has had that impression done. We now have an optical way to make an impression through intraoral scanners. Either way is fine, it just has to be perfect. So we make that impression, we send it to the lab, and now the lab has to do their part perfectly. A good lab will use a microscope to make the die, which is the stone model of the preparation. They will use a microscope to make the crown. So when it comes back, we've maintained that perfection of that margin that would fit to within 200 microns. We try it in, we make all the necessary adjustments, and we cement it. That crown should last you decades, literally decades. Why don't they? Because you many times have a crown that was made by a doctor who doesn't care about outcomes. They only care about income. Secondarily, they didn't have the fine motor skills to start with. They got through dental school, but they couldn't do the work. Another factor is speed. Many dentists make more money by going faster. Speed usually is the enemy of good outcomes. Thirdly, fourthly, fifthly, whatever this is now, most dentists cannot make perfect impressions of the tooth that they just prepared. So they send a lab an impression that is not accurate. The best the lab can do is make a crown that comes close to fitting. Well, this isn't horseshoes. Close does not count in dentistry. That little margin of 200 microns, if it's larger than that, it fills in with cement temporarily. The cement washes out and then a cavity starts. That's why crowns fail, is they never fit in the first place. The average crown nowadays for many insurance patients is 3 to 7 years, and then the dentist wants to redo it. So you may have insurance that paid for a large part of that, but if you're repeating that every 5 years, let's say, is that really cost effective? So I hope this helps you understand what it takes to get a really good outcome for one single crown. Let's talk about what if you need 2 or 3 or 10 or 28 crowns. It gets exponentially harder to do those multiple crown treatments. So finding a dentist who has the skill set and the motivation to deliver great results is not easy. It's very difficult to find that type of practitioner. With online reviews, I think that the consumer has a better chance. So I would encourage all of you that are considering complex dental work or even one single crown, go online, do your research, and go to the practitioner that you think will give you the best outcomes, and then ask him or her to explain to you how you're going to get a great outcome. Ask to see some of their work. Do as much research as you can, because this is a long-term treatment, or should be a long-term treatment. You want this thing to last decades. I hope that helps. Thank you for listening.